7 symptoms in your body before a heart attack. Sudden heart attack. Did you know that your body can be giving warning signs up to a month before a heart attack? Often, people ignore minor discomforts or symptoms because they do not relate directly to the heart. Why have heart attacks been so common, including among young people? How to recognize the signs and prevent something worse from happening? Today, we're going to talk about 7 signs that may indicate that you're on your way to a heart attack, and the reasons behind the alarming increase in heart attacks, even in seemingly healthy people. If you know someone who has been through this or want to know more about how to protect your health, stay with us until the end of this text. This information can literally save a life. Let's get started. What causes a heart attack? A heart attack, also called a myocardial infarction, occurs when blood flow to the heart is interrupted. This disruption is usually caused by a blockage in the coronary arteries, which are responsible for bringing oxygen and nutrients to the heart. These blockages form due to the accumulation of plaques of fat, cholesterol, and other substances on the walls of the arteries, in a process known as atherosclerosis. Atherosclerosis is a silent problem that develops over years, gradually narrowing blood vessels and making it difficult for blood to pass through. When one of these plaques ruptures, it can trigger the formation of a clot that completely blocks blood flow. Without enough blood, the heart muscle begins to suffer damage. This process can be aggravated by factors such as high blood pressure, diabetes, high cholesterol, smoking, and obesity, all of which contribute to inflammation and an increased risk of heart attack. In addition, excessive stress and lack of regular physical exercise also play important roles. Although many people believe that a heart attack is something sudden, it is actually the result of years of aggression to the cardiovascular system. Therefore, it is crucial to understand the risk factors and perform periodic examinations to identify problems before they become serious. Now that you know what causes a heart attack, let's explore what happens to your body during that event and how it gives you warning signs. What happens to your body when you have a heart attack? During a heart attack, the body goes through a sequence of events that can be devastating. The heart, which works like a pump that distributes blood throughout the body, depends on a continuous flow of oxygen and nutrients to play its role. When this flow is blocked, even partially, the affected region of the heart muscle begins to suffer. Within minutes, oxygen-deprived heart cells begin to die. This process, called necrosis, compromises the heart's ability to pump blood efficiently. In addition, the body realizes that something is wrong and activates a series of emergency responses. You may feel strong pressure in your chest, often described as a feeling of tightness or heaviness, that can radiate to your left arm, jaw, back, or even your stomach. Lack of oxygen can cause dizziness, cold sweat, nausea, and a feeling of generalized weakness. The nervous system also kicks in, trying to compensate for the problem by speeding up the heartbeat and increasing blood pressure. But this can often put even more strain on the already weakened heart. When not treated in time, the heart attack can lead to the death of a significant part of the heart muscle, permanently affecting its function. In more severe cases, it can trigger fatal arrhythmias or even cardiac arrest. It is important to remember that symptoms can vary, especially between men and women. While men tend to experience more typical chest pain, women often experience symptoms such as extreme tiredness, stomach discomfort, and back pain, which can delay diagnosis. Therefore, recognizing these signs early is essential to seek medical help and avoid further damage. Now that we understand what happens during a heart attack, it's time to talk about the warning signs your body can give you before a heart attack. Is it possible to reverse a pre-heart attack or a silent heart attack? Yes, it is possible to reverse a pre-heart attack or minimize the damage of a silent heart attack, but this requires quick action and a proper approach. Pre-infarction occurs when blood flow to the heart is reduced, but not entirely blocked, which prevents severe or permanent damage to the heart muscle. This is a warning sign from the body that something is wrong, and the best way to respond is to seek medical help immediately. Rapid treatment can prevent the pre-infarction from evolving into a full-blown heart attack. Common interventions include the use of medications that dilate arteries, reduce clots, and improve blood flow, such as vasodilators and blood thinners. Additionally, in more severe cases, procedures such as angioplasty may be necessary to unclog the arteries and restore blood flow. A silent heart attack, which occurs without the typical symptoms, can be even more dangerous because it often goes unnoticed until it's too late. Therefore, recognizing subtle signs, such as unexplained tiredness, discomfort in less obvious areas, and cold sweat, can make all the difference. While it is possible to reverse the initial effects of these events, prevention is still the best approach. This includes lifestyle changes such as a balanced diet, regular exercise, and control of risk factors such as high cholesterol, hypertension, and diabetes. In addition, regular exams such as the electrocardiogram and exercise test help monitor heart health and identify problems before they get worse. Reversing a pre-heart attack or detecting a silent heart attack in time is possible, but it requires attention to the body's signals and immediate search for professional help. In the next section, we will explore the consequences of ignoring these warning signs and the risks of not seeking treatment. Ignoring your body's warning signs can have serious and often irreversible consequences. When the symptoms of a pre-heart attack or silent heart attack do not receive attention, the problem can progress to a full-blown heart attack, causing permanent damage to the heart. The heart, like any other muscle in the body, relies on a constant supply of oxygen and nutrients to function properly. If blood flow is interrupted for too long, parts of the heart muscle begin to die, resulting in scarring in the heart tissue. This compromises the heart's ability to pump blood efficiently, which can lead to heart failure. Heart failure is a condition in which the heart cannot meet the demands of the body, causing symptoms such as shortness of breath, extreme tiredness, and swelling in the legs and feet. In addition, the risk of fatal arrhythmias such as ventricular fibrillation increases significantly. This condition causes the heart to beat in a disordered manner, and without quick intervention can lead to cardiac arrest. Another serious consequence of ignoring the warning signs is the increased risk of sudden death. Studies show that most heart attack-related deaths occur within the first hour of symptom onset, known as the golden hour. In this window of time, medical interventions, such as medications or emergency procedures, are most effective in saving lives. In addition to the physical risks, there is also a significant emotional and psychological impact. People who suffer a heart attack and survive often face fear, anxiety, and depression, which can impair their quality of life. Negligence can also bring high financial costs, with prolonged hospitalizations, surgeries, and the need for continuous treatments. Therefore, not treating the warning signs not only puts your life at risk, but also compromises your long-term health. In the next section, we'll discuss how to identify whether the symptoms you're experiencing are actually warning signs or not. How to identify if what you are feeling is a warning sign or not. Not all discomfort or tiredness indicates a heart problem, but knowing how to differentiate common symptoms from those that are warning signs can save lives. The first step in identifying if what you're feeling is a warning sign is to pay attention to the intensity, duration, and frequency of symptoms. For example, extreme tiredness that comes on suddenly, even after simple tasks such as walking or climbing stairs, should be taken seriously. Similarly, persistent discomfort in the stomach, back, jaw, or chest that does not go away with rest or with common medications can be signs of something more serious. Another important point is to consider the risk factors you may have. If you are a smoker, have high blood pressure, high cholesterol, diabetes, or a family history of heart problems, the likelihood that the symptoms are heart-related is higher. In addition, symptoms that appear after physical exertion, situations of intense stress, or even during rest, such as cold sweat, dizziness, or numbness in one of the arms, are classic signs that should not be ignored. A practical way to assess the severity of the symptom is to observe whether it improves or worsens over time. Symptoms that are persistent or that progressively worsen over days or weeks require immediate medical attention. While it's tempting to attribute these discomforts to less serious causes, such as poor digestion or muscle pain, it's critical not to underestimate the signs. The best way to be sure is to see a healthcare professional as soon as you notice something different about your body. Simple tests, such as an electrocardiogram or a blood enzyme test, can identify if there is something wrong with the heart. Ignoring or minimizing these symptoms can lead to serious consequences, as we discussed earlier. Therefore, at the slightest sign of doubt, seek medical help. In the next topic, we will detail the 7 most common warning signs that the body can give before a heart attack. Warning signs: how your body warns you before a heart attack. First, digestive discomfort and stomach pain. The digestive discomfort is one of the most common signs, especially in women and the elderly. It can manifest as burning, bloating, or a feeling of heaviness in the stomach that is often mistaken for gastritis or liver problems. This discomfort can arise during or after meals, and even while you walk or perform a little physical effort. If you have risk factors such as high blood pressure or high cholesterol, don't ignore this feeling, especially if it's accompanied by other unusual symptoms. Many people seek antacids or liver medicine, but when the problem doesn't improve, it can be a warning sign that something more serious is happening to your heart. Second, extreme tiredness and lack of effort. An intense tiredness, even in simple tasks, can be an early sign that the heart is not getting enough oxygen. It is common for this symptom to appear days or even weeks before a heart attack, often accompanied by shortness of breath. This feeling of weakness and exhaustion can be misinterpreted as flu, cold, or stress, which delays diagnosis. If you notice that you are getting more tired than usual for routine activities, such as climbing stairs or walking short distances, see a doctor. Third, pain in the jaw and other parts of the body. The jaw sores, especially on the left side, can be one of the most surprising warning signs of a heart attack. This is because the nerves in the heart share connections with other parts of the body, such as the jaw and neck. Because of this, the brain can interpret cardiac distress as pain in less obvious areas. If this pain comes on suddenly, with no apparent explanation, and does not improve, seek medical help immediately. Fourth, cold sweat and paleness. Suring cold sweat out of nowhere, even at rest, is one of the most reported symptoms by people who have suffered heart attacks. This sweat is different from regular sweat. It is usually sticky and is often accompanied by a sudden pallor. Even if it disappears in a few minutes, it can be a warning that the heart is struggling to function. Fifth, back pain, especially in the scapulae region. Many people do not associate back pain with heart problems, but it is a common symptom, especially in women. This pain can be mild and intermittent, or in more severe cases, intense and persistent, radiating to the neck and arms. If back pain comes on unexpectedly and is accompanied by shortness of breath or other symptoms, see a doctor immediately. Sixth, numbness in the hands or left arm. The numbness or tingling in the left arm is a classic sign of heart problems, but it is often ignored. This sensation can appear during physical activities or even at rest. If it appears for no apparent reason and is accompanied by other symptoms, such as tiredness or chest pain, it is essential to seek medical help. Seventh, dizziness and feeling faint. Suddenly faint or feeling faint may indicate that the heart is not pumping blood properly to the brain. This can be caused by a sudden drop in blood pressure or by cardiac arrhythmias that compromise circulation. If you've never had this symptom and it appears suddenly, especially during physical exertion, consider it a warning sign. Now that you know the 7 main warning signs, let's understand what a pre-heart attack is and how it differs from a full-blown heart attack. Understanding what a pre-infarction is. Pre-infarction, also called unstable angina, is a condition in which the heart does not receive enough oxygen due to reduced blood flow. While it doesn't cause permanent damage like a heart attack, it's a clear sign that something isn't working properly in the cardiovascular system. In the pre-infarction, the flow of blood to the heart is only partially interrupted, which causes symptoms similar to those of a complete infarction, but in less intensity and duration. Typical symptoms include chest pain or pressure, which can radiate to the arm, jaw, back, or stomach. This pain usually appears during physical exertion or stressful situations, but disappears with rest or the use of medications, such as vasodilators. However, this condition should not be ignored, as it is a warning that the arteries are narrowed or partially blocked and that the risk of a full-blown heart attack is high. Pre-infarction can occur days or even weeks before a full-blown heart attack. and in many cases, it's the last chance to take action to prevent serious damage to the heart. Diagnosing a pre-infarction requires specific medical tests, such as an electrocardiogram, echocardiogram, and blood tests to assess the presence of cardiac enzymes. In addition, procedures such as coronary angiography may be necessary to identify blockages in the arteries. Pre-infarction treatment may include medications to thin the blood, lower blood pressure, and ease the heart's workload. In more severe cases, procedures such as angioplasty or bypass surgery may be necessary to restore blood flow. It is essential to understand that pre-infarction is not a mild diagnosis. It is a sign that the arteries are vulnerable and that immediate lifestyle changes, as well as medical treatment, are essential to avoid major complications. In the next section, we'll explore why heart attacks are becoming increasingly common in young people. Why are heart attacks increasing in young people? In recent years, statistics on heart attacks in young people have become alarming. Public health reports indicate a significant increase in the number of heart attacks in people under the age of 40, including women and individuals with no prior history of heart problems. But why is this happening? One of the main reasons is the modern lifestyle. The diet, rich in ultra-processed products, saturated fats, sugars, and excess sodium, is one of the biggest culprits. This type of diet promotes the accumulation of bad cholesterol in the arteries, leading to the development of atherosclerosis at a young age. In addition, a sedentary lifestyle is a growing problem. Many people spend hours sitting, whether at work, in traffic, or in front of screens, which drastically reduces blood circulation and cardiovascular health. Another critical factor is chronic stress, which is directly linked to heart problems. Pressure for results at work, excessive use of electronic devices, and lack of adequate rest increase levels of cortisol, a hormone that can raise blood pressure and contribute to inflammation of the arteries. Lack of quality sleep also plays a significant role. Studies show that sleeping less than 6 hours a night is associated with a higher risk of cardiovascular disease. Smoking and excessive alcohol consumption also continue to be villains, especially among young people who do not realize the cumulative damage that these habits cause over time. Another point of concern is the increase in the diagnosis of diseases such as type 2 diabetes and high blood pressure in young people, conditions that were previously considered health problems for older people. The obesity pandemic cannot be ignored either. Being overweight, especially abdominal fat, is a significant risk factor for heart disease. In addition, genetic factors and family histories of heart problems can increase the risk, even in young and apparently healthy people. Finally, limited knowledge about warning signs and cardiovascular risks in young people contributes to delayed diagnosis and treatment. People often ignore subtle symptoms or believe that heart problems don't happen in youth. This alarming increase in heart attack cases in young people is a warning that we need to rethink our habits and take care of our heart health from an early age. In the next section, we will discuss how the modern lifestyle has a direct influence on heart health and what can be done to minimize these impacts. How our modern lifestyle influences heart health. The modern lifestyle offers convenience but has severely impacted heart health. Poor diet, physical inactivity, chronic stress, and sleep deprivation have fueled the rise of cardiovascular diseases. One major culprit is unhealthy eating habits. Ultra-processed foods high in trans fats, sodium, and refined sugars increase cholesterol and contribute to atherosclerosis. The shift from home-cooked meals to fast food has reduced dietary quality and balance. Sedentary behavior is another issue. Long hours at desks and excessive screen time have led to reduced physical activity, weakening the cardiovascular system and impairing circulation. Chronic stress, fueled by work pressures, financial worries, and social media, raises cortisol levels, increasing blood pressure and arterial inflammation. Sleep deprivation further worsens heart health. Less than 6 hours of sleep per night raises the risk of hypertension, obesity, and diabetes, while also preventing the body's proper recovery. Additionally, smoking and excessive alcohol consumption continue to harm the heart, especially among younger individuals who underestimate their long-term effects. Many believe youth protects them from heart disease, leading to late diagnoses and severe consequences. Despite these risks, adopting healthier daily habits can protect the heart and prevent future problems. In the next section, we will explore essential tests for detecting heart issues and maintaining cardiovascular health. What tests should I do to identify heart problems? Keeping your heart healthy requires attention and preventive exams to detect silent conditions that could lead to serious problems like heart attacks or heart failure. The electrocardiogram, ECG, is a fundamental test that evaluates heart rhythm and detects electrical conduction issues. The echocardiogram, using ultrasound, provides detailed images of the heart's structure, valve function, and pumping capacity. The stress test assesses how the heart responds to physical exertion, helping diagnose coronary artery disease, especially in individuals with hypertension or diabetes. Blood tests monitor cholesterol levels, total LDL bad, HDL good, and triglycerides, to assess the risk of atherosclerosis. Measuring troponin levels is crucial in suspected heart attack cases as it indicates heart muscle damage. The 24-hour Holter test continuously records the heart's electrical activity, identifying arrhythmias that might not appear in a standard ECG. For a more detailed assessment, coronary angiography uses contrast dye to detect arterial blockages that restrict blood flow. For those with conditions like hypertension or diabetes, ambulatory blood pressure monitoring, ABPM, tracks variations throughout the day. Cardiac MRI provides an in-depth view of heart structure, detects muscle scars, and measures pumping efficiency. Regular cardiology checkups help determine which tests are necessary based on age, family history, and individual risk factors. In the next section, we'll share practical tips for preventing heart attacks at any age. Tips to prevent a heart attack while still young. Preventing a heart attack is possible with small lifestyle changes. A balanced diet is key. Prioritize fruits, vegetables, legumes, whole grains, and lean proteins while avoiding ultra-processed foods high in bad fats, sugars, and sodium. Regular physical activity strengthens the heart and improves circulation. Walking, jogging, weight training, or dancing for at least 30 minutes a day, 5 times a week, is ideal. Maintaining a healthy weight is also essential, as excess abdominal fat increases cardiovascular risks. If you smoke, quitting is one of the best things you can do for your heart. Smoking hardens arteries and reduces blood flow. Reducing alcohol consumption is equally important, as excessive drinking raises blood pressure and cholesterol levels. Managing stress through meditation, yoga, or enjoyable activities helps protect heart health. Quality sleep is crucial, as it regulates cortisol and lowers blood pressure. Regular health checkups, including blood pressure, cholesterol, and glucose monitoring, can detect issues early. Avoiding excessive processed vegetable oils and choosing healthy fats like olive oil and avocado reduces artery inflammation. Regular visits to a cardiologist, even without symptoms, are vital for prevention. Taking care of your heart is an act of self-love and an investment in your future. Every choice toward a healthier lifestyle improves both longevity and quality of life. Share this knowledge with loved ones. Prevention is a gift, and prioritizing heart health today ensures a better tomorrow.